For the video today, we're going to be doing some orthopedic tests. We're going to start with testing the spinal cord and meninges. We're going to start with the hermit sign. We're going to ask the patient to flex their head, and positive will be shock electric-like sensation down the spine and extremities. And the indication will be for the spinal cord inflammation, degeneration, or injury. For curling sign, we're going to bend the knee 90 degrees, and we're going to straight up the leg. And positive will be pain in the neck area, an indication of meningeal irritation or meningitis. For Bromsinski sign, we're going to flex the leg, and positive will be flexion of the knees, involuntary flexion of the knee, indicating meningeal irritation or meningitis. For cervical structure test, we're going to start doing the Soto Hall test. We're going to ask the patient to cross their hands in front of the chest for stabilization, and we're going to flex the head. Positive will be pain in the neck. Possible can get down onto T2, and the indications are not specific for the structured integrity of the cervical region. For Bell's valve humor, we're going to ask the patient to take a deep breath and compress their abdomen. And positive will be radiating pain from the site of their lesion and indicating nerve root entrapment by this lesion. For foraminal encroachment test, we're going to start with cervical foraminal compression. We're going to ask the patient to sit straight forward and push down. And if this gives negative, we're going to rotate the head and push down, and rotate the head and push down. The positive will be local pain indicating foraminal without nerve root rotation, and radiating pain indicating foraminal encroachment of the facet. Facetal is like a pathology with nerve root compression. For Jackson compression test, we're going to laterally flex the head of the patient and push down, and laterally flex and push down. Positive will be local pain without nerve root compression or radiating pain with nerve root compression. Now for maximal cervical compression, we're going to laterally flex the head and extend it, and this will be positive will be pain on the concave side, an indication of foraminal encroachment with or without nerve root compression. For cervical distraction test, we're going to put our hands on the mastoid of the patient and distract up. Positive will be decrease or absence of pain, an indication of foraminal encroachment syndrome with or without nerve root compression, based off the present or absent or radiculopathy signs. For ergotic sign, we're going to ask the patient to put their affected hand inside of their head, and positive will be decreased or absent or radiating pain, indicating traction of the upper brachial flexure by the suprascapular nerve, relaxing the traction and reducing pain. For thoracic outlet syndrome, we're gonna do first the Axon test. We're gonna take the radial pulse of the patient. We're gonna ask the patient to extend their head and rotate it toward me. We're gonna straight up the arm while he's holding the breath. Then to the other side. Positive will be decrease or absence of the radial pulse, pain, pallor, or paresthesia in the arm, an indication of neurovascular bundle, entrainment of the thoracic outlet syndrome, compression of the brachial flexure and subclavian artery. For Eden test, we're gonna take the radial pulse, straight up the arm. We're gonna ask the patient to put their shoulders back and forward, head the forward head, and take a deep breath and hold. Positive will be pain, paresthesia, you can relax. Decrease or absence on the pulse and indicating compression of the neurovascular bundle between the clavicle and the rib. For right test, we're gonna abduct the arm. And positive will be pain, pallor, paresthesia, decrease of radial pulse, an indication of thoracic outlet syndrome. Ulnar nerve test, we're gonna start doing thinner elbow. We're gonna flex the elbow. Positive will indicate burning sensation toward the entire distribution of the ulnar nerve, indicating ulnar neuroma. For frogman paper test, sign test, we're gonna ask the patient to make a fist and grab the paper with the thumb. Positive will be inability of holding the paper with the thumb or recruiting the thumb. This indicates paralysis or weakness of the ulnar nerve innervating muscles. Median nerve test, we're gonna start doing Fallen test, is to put the wrists together for 60 seconds. Positive, you can relax. Positive will be pain in the median nerve area. That will be digit 1, 2, 3, and half of the lateral of the 4 digits, and indicating median nerve stretchment, median nerve neuritis, or carpal tunnel syndrome. For brainstem test, we're gonna ask the patient to put their hands like this. And the positive will be the same, distribution of the pain in the median nerve area, digit 1, 2, 3, and half of lateral of the 4 digit. And indicating exactly the same, median nerve entrenchment, median nerve neuritis, or carpal tunnel syndrome. For thinner wrist test, we're gonna use the hammer and hit between the hypothenar and thenar, and positive will be distribution pain on the median nerve area, digit 1, 2, 3, and half lateral of the 4 digits, and indicating median nerve entrenchment, median nerve neuritis, or carpal tunnel syndrome. For Beaver sign test, I'm gonna ask the patient to crunch the abdomen, and we're looking for the umbilicus to move up or down. That will be an indication of weakness in the lower half of the abdominal musculature, and that can be a lesion on the nerve root or T11 or to T12 nerve root, or a spinal cord lesion, and if we move down, can be a nerve root lesion of the T7 to T10. For Chapelman test, we're gonna ask the patient to put their arm up and lateral flex through both sides. Positive will be pain in the concave side, indicating intercostal neuritis, while pain in the convex side will be indicating fibrous inflammatory of the pleura or possible intercostal myofasciitis.